Welcome to this Tech Takeover edition of Vet2Vet. I'm Sam Sacasa, a certified veterinary technician and VetFolio educational specialist. Joining us is licensed veterinary technician Amanda Friedeck. Amanda is a veterinary technician specialist in dermatology who has published numerous articles as well as a book chapter on dermatologic conditions. Today she's here to talk about canine otitis externa and the veterinary technician's role in diagnostics and treatment. Amanda, I'm so excited to talk to you about this today. Otitis externa is such a common issue, and veterinary technicians can play a key role in helping these dogs get back to feeling pain-free.
Thank you so much for having me.
What do you think is the best practice for performing ear cytologies, and what is important for veterinary technicians to keep in mind when obtaining samples?
Oh, ears. Ears are definitely an interesting problem that all of us technicians face.
For sure.
Definitely. The biggest thing I see is a lot of technicians are a little too aggressive when they are doing their samples. You can cause a lot of pain, a lot of trauma when you're doing them. And so, be gentle when you're doing your samples.
That's great to keep in mind. Do you heat fix or do you not heat fix your samples?
We do not heat fix.
Okay.
That's what your fixative is for. We've had a few projects that we have done with heat fixing, and it can damage the sample if you don't do it correctly. So if you do heat fix them, be easy on your sample. Don't bake it. We're not baking the samples. So just, be careful if you're doing it.
Yeah, absolutely. I feel like this is a topic that I see go all over the place. So I was curious.
Yeah. I think it's veterinary dependent.
Sure.
So,
what method do you prefer for scanning ear cytologies?
for scanning them, I prefer to use 10x. That's the one I use more commonly to find good areas on our samples to look at. Just randomly picking a someplace on a slide is really not going to give you anything. And so I use a 10x to really find an area to focus on. And then from there, I go ahead and drop down to 100x and see what I have there. That usually gives you a better idea of what you're looking at. 100x, you can't really diagnose bacteria or yeast very well off of 10 because there's a lot of sample that does look like yeast and bacteria at 10x. And until you get to 100, you really can't distinguish 100%.
That's great. Yeah. I think we're all taught in school to start at 10x, so I'm happy that you brought that up because that's something we should all still be doing. Once a diagnosis is made, there are many products a veterinarian can prescribe. Can you talk a little about the different otitis medications and what technicians need to know about the treatment options available?
There's many, many, many different types. When we're teaching our vet students, we actually teach them ingredients, not necessarily brands, because so many treatments out there are the same ingredient, just different name. And so depending on what you're dealing with really will depend on what kind of treatment option you're going to have. If you just have yeast, you might just want an antifungal medication. Sometimes you don't need the steroid. So, it just depends on what you're looking at when you're actually doing your physical exam as well as looking at your samples. We have everything from once a day. They've got the long-term stuff that you can use. We have homemade, we call them recipes, but we also have a pharmacist that actually concocts these for us. And so depending on what we're dealing with, what the owner has used in the past, it really varies as to what treatment we're going to be going with.
Yeah, I love that. I love that individualistic approach.
Very much so.
Yeah. How can veterinary technicians be advocates for the pet owner? What kind of information do we need to gather and share with the veterinarian so that the pet receives the best treatment option?
History is probably one of the most important things that veterinary technicians do. So if you have ear problems come in, you need to talk with the owner. What have they tried in the past? Have they done ear flushes? Or how is it actually giving the ear medication? Are they actually able to do the ear treatments? If they're not able to do the ear treatments, there's no point in sitting home a daily ear medication because they're not going to be able to do it. And so it's really important to talk to the owner about what they're able to do, what the animal will let them do. Is the animal trying to bite them while they're trying to do these ear medications? So, the human animal bond is very, very important. And that's something that we want to try to maintain throughout the treatment of ears because it's going to be a long-term, lifelong thing, unfortunately, with ears.
Yeah, I think it's really important to gauge the owner's comfort level because if not, it's not going to be successful. So I do think that that is a really important area for technicians to focus on.
Very much so.
So we were talking earlier about the different treatment options and how some of them are daily, just once. If a 2-dose treatment is indicated, how can technicians be utilized to make this easier in a busy practice setting?
Yeah, I mean, we got, the long-term Ocernia that does come with a 2 dosing. They want it to be 1 week separate between the first dose and the second dose. The easiest way to accomplish the second dose, we have what we call tech appointments, which basically the animal schedules directly with me as to a good time that works with the owner as well as myself. The animal comes in, I just bring them to the back, take care of their dosing, get them out the door. So we really try to make it very, very easy. And the easier it is, the more compliant an owner is going to be when it comes to doing the second dosing.
Absolutely. I love that. I love technician appointments. I think that they increase job satisfaction because they're fun and there's a level of trust and autonomy associated with them. So I would always encourage an office to have tech appointments as often as possible.
Yes, yes, definitely.
Sometimes when ear canals become stenotic, it can be challenging to medicate, and it seems like more of the medication ends up out of the ear canal than in. What do you recommend for getting that medication in the ear canal so it can be as effective as possible?
Yeah, when you start talking about stenosis of the ears, we're really working on the end stage ears of
Mm-hmm.
ear disease. A lot of these, it's either treat these ears or they're going to have to go to surgery. And what I have found works really, really well in these very stenotic ears, I actually use the outer casing of a small catheter, and it's nice and soft and supple without the needle. Don't use the needle on it. You can drop the ear medication in a syringe, and then that really small catheter can actually get fairly far down those very stenotic ears, and you at least get some medication into the actual canal to see if we can help it.
My goodness, I love that idea so much. I honestly just think it's genius, and I'm sad I never thought of it. But yes, that is a great idea.
Yeah.
So you mentioned end-stage otitis and TICA surgeries. What steps can the veterinary team take to avoid TICA surgery?
Um, Sometimes it's not avoidable. I mean, sometimes it happens. The best thing is to refer these sooner rather than later. I know some owners are totally against going to see a dermatologist, um, but the longer you wait, the harder it is for a dermatologist to actually be able to revert some of the things that are there. I mean, stenosis, we can revert a lot of the times unless it's starting to calcify. You start getting calcification on the ear canals, and we can't revert bone. I mean, once it calcifies, there's nothing a dermatologist can do. The more you treat the ears, the higher the chance of resistant otitis media. And if it's resistant, you can't treat it. And so surgery is the only option at that point in time.
Right. Yeah, and I worked for a veterinarian that did a lot of TICA surgeries, and I noticed that it was very sad for a lot of the owners and that they felt guilty because they weren't able to fix the problem. So hopefully communicating with them, saying, okay, we're not at the point where it's not reversible, but we might get there soon, is really important.
Yeah. I mean, TICA sounds like a very barbaric surgery. I mean, owners really think that we're going to go in and
Sure.
remove everything, that it's going to be a slick-headed dog. And so, I mean, really, talking with owners, they're still going to have the pinna. It's just there's not going to be a hole. It's going to look like a teddy bear ear.
Right.
We have owners in a list that they have agreed to be on this list for owners that have gone through a TICA, that can talk to other owners about their experience with the TICA, because a lot of times these dogs, they have years of otitis and pain, and then they're slowing down, and the owners think, well, it's just because they're old, because they're slowing down. But then they go have this TICA surgery, and all of a sudden they're a puppy again. They were slowing down because the pain of the ears, not because of their age. And so you have other owners talking to owners about their experience and how they handled it and went through it. And sometimes that really helps other owners.
Oh my gosh, what a great idea. I love that. And I love that you said teddy bear ears. That's a great way to
Yeah.
describe it. Yeah,
They'll still have the flap. It's just no hole.
that's awesome. Before any otitis medication is administered, there's usually a good ear cleaning that needs to happen. What do you believe is the best method for cleaning ears, and how do you educate owners so that they can do this at home?
We always show owners how to clean ears. I don't care if they've been to see us 10, 15 times. If they are going home with an ear cleaner, we are going to show them how to do it. It's not as intuitive as most people think. It's like, oh, yeah, just clean the ears. Owners really don't know how. I usually don't recommend using just the cone and shoving the whole bottle in the ear and squeezing. A lot of people, you can get too far in and actually traumatize the ear with the hard cone of the bottle. And also people squeeze it and they let go and it sucks all that juice back into the bottle. And now you've contaminated it and it's a bad thing all around. So usually what I recommend for owners is soaking a cotton ball, and then even head shy dogs that hate having their ear cleaned, a lot of times you could sneak the cotton ball into their ear, massage the ear canal and wipe out what you can see and let them shake their head from there.
Right. I like that. It's definitely a more gentler approach. Speaking of client education, what do you think is really important to communicate to owners of dogs with chronic otitis? What are some of the tips you have for getting those important points across to the pet owner?
One of the biggest things with ears is rechecks.
Mm,
It's going to be continual. We have to maintain ears. You're not just going to treat it once and ta-da, you're done. I mean, it's usually they have the ear problems because of something else, usually allergies. And if we don't maintain, then they're going to have flares. They're going to have problems. Even if we're maintaining, they're still going to have flares. I mean, they're going to have problems. They have ear issues. Um, Rechecks really help make sure that everything is under control, not just the ears, and that helps maintain things in the long run. But if your dog has ear problems, they're going to have problems. There's no way even a dermatologist can stop them from happening. We just try and decrease the severity and the number of them they have per year.
right, and catch it before it gets bad.
Yeah.
I'm glad that you mentioned how heavily allergies are associated with otitis
Mhm.
because I feel like owners sometimes will just treat one and not both, and that
Yeah.
it just becomes like a back and forth.
Yes. Yes. It's definitely two sides of the same coin.
Yeah.
You have to deal with both sides. You can't just pick one.
Yeah, absolutely. I think that's really important to communicate to the owner.
Yeah.
So, we talked a little bit about allergies. When treating chronic otitis, there's usually concurrent allergy issues. How do we find that this affects the owner, and what can we do to support them in getting their pet back on track?
Oh, allergies can be an entire tech talk itself, unfortunately. But allergies in general are very, very frustrating. You do everything you can for these patients. You have them on all the meds, you're doing all the maintenance. It's a lot of maintenance, a lot of topicals, a lot of shampoos, ear cleaners, those type of things, and they're still going to flare. It's very frustrating for owners because they want normal dog and they're allergic. They're never going to be normal dog. So trying to convey to owners, we are looking for a reasonable level of maintenance. We are never going to be 100% normal, but you know, ear cleanings are very important for allergic dogs, whether they have ear problems or not, because allergies will make them prone to ear issues. And so, maintenance, we're looking at least twice a month cleaning just for basic maintenance of a allergic dog that does not have ear problems, and probably weekly for those that actually do have ear issues.
Right. Yeah,
Yeah,
it's extremely emotionally taxing for the owner.
it is.
Yeah. And I think that that's great that you're recommending just to give very clear, honest expectations right from the very
Mhm.
beginning.
Yeah, and as a technician, you need to, when you're doing your history, make sure that the human animal bond is not being affected by the things that we're sending home. Because we send home a lot. A dermatologist, we are sending home a lot of things for owners to do. We try to limit those, but there's some times where you're going to have a shampoo and an ear cleaner and an oral and another oral and an ear, I mean, it's a lot. And so we do what we can to minimize that, which sometimes means the long-term ear medications that are out there that sometimes will take that one thing off the owner's plate, what makes it a little easier for them. So, I mean, human animal bond is very important with allergies and trying to maintain. We don't want this owner to get home and the cat or the dog just bolt under the bed and never come back out again because, like, oh my gosh, they're going to be doing more things to me all the time. So, as a technician, it's very important to discuss with the owner to make sure that bond is still there and that we are not affecting it in any way.
Well, since you brought it up, because I always try to consider the human animal bond in everything that we do, how can chronic otitis affect the human animal bond? You talked about that a little bit. And how can we as technicians help preserve that bond?
Um, I mean, if you think about it, you're sitting there sleeping and this person comes over, they pick you up and start pouring things down your ear. It's not a fun experience for the animals. None of them like it. I mean, that's why I do the cotton ball. To me, it's a little bit more gentle with the patients than just flooding their ear. To me, that would make me, I mean, all of a sudden you get all this cold water in your ear. It's like, ooh. So, I mean, for me, the animals seem to like the cotton ball technique a lot better. It's a little easier on them, and you can do it while they're sleeping. You don't have to be moving them around. Um, it's very hard to maintain the human animal bond, unfortunately, with allergy stuff, but we do everything we can to try and decrease the amount that the owners are having to do. Yeah, because it's hard. It's really hard trying to maintain that bond.
Yeah, it is, but I think you gave a lot of great recommendations for how we can support the owners. Amanda, thank you so much for joining us today.
No, thank you so much for having me.
And thank you to Decra for sponsoring this Tech Takeover edition of Vet2Vet. Check out vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, great patient care starts with self-care.